Good afternoon, everyone, and welcome to our virtual event. I'm so excited to have a chance to welcome everyone. We have over 200 people here right across the country, from BC and Vancouver right over to Newfoundland. And so really excited to welcome you to this session. So my name is Dante Mora, and I'm the chair of the CanHealth Network. And I also serve as the Chief of Staff at Trillium Health Partners, one of Canada's largest academically affiliated hospitals in West Toronto and Mississauga. And I have the pleasure of being your MC today for an amazing event. So today we're talking about something really important, and that is how Canada can lead a new healthcare economy, how this country can come together, and how prosperity can be led as we positively disrupt the new industry, creating jobs across the country, but also changing health outcomes. And I think we have a great panel coming up, some wonderful ministers and their comments, and just super excited to welcome you today's session. So while we're talking about this, it's really important that we acknowledge the year that we've had. Everyone in the network, the edges and the contributors, they're all operators. These are all healthcare providers, some large, some smaller, but operators of healthcare that have served in a truly historic moment and have provided care during this pandemic. And I just want to take a moment to thank you and thank the people that you represent. And that's to our operators, but also to our partners in government and all of our different stakeholders in the CanHealth Network. Everyone is doing their work to help Canada be strong. And that's everything from the front line to procuring vaccine and everything in between. So really hats off to all of you. So today we have the opportunity to hear from two ministers, and we get a chance to have a panel discussion with companies and edges, and also announce some really exciting news about the expansion of the network and how this network is driving prosperity, creating Canadian jobs, and helping health outcomes. So it's my pleasure to introduce our first speaker. This is the person who started this. So it started with a challenge from Minister Ng, sort of challenging us to say, why can't Canada lead in economies where they have natural advantage? Why can't we scale our small businesses more effectively? And that was the kernel. That was the start of the concept behind the CanHealth Network. And I've had a chance to watch Minister Ng working in so many different parts. And Minister, I'll pass it over to you for your comments, and thank you for all your support, and thank you for everything you're doing for our country in your many different roles. Minister?
Well, thank you so much, Dr. Mora. Dante, that's a wonderful and kind introduction. And I will echo what you have just said, which is it has certainly been a very difficult time across the country, across the globe. And to all of, to everyone who is working in the healthcare sector right now on the front lines, and that is everyone. I also want to echo that enormous appreciation for all of the work that you are doing. I can't think of a time in our history where we've had to bandy together the way we are in an effort to keep Canadians safe, and just a huge appreciation for all of our healthcare workers across the country for what you are all doing. And before I begin, I do want to acknowledge that I'm speaking to everyone from the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Wendat people. And for those of us who are settlers or even immigrants to Canada, it's important to recognize that Indigenous peoples were here long before us, and that we all have a role to play in reconciliation. I'm thrilled to be here alongside with my friend and colleague, Minister O'Regan, who will be joining us very shortly. And as I was saying to Dr. Mora earlier, along with the rest of the panelists who are with us, that I actually also simultaneously am here in the Parliament of Canada, just through another screen. So if I pause for a moment to vote, that will be why, and that is where Minister O'Regan is right now. We're both doing a little bit of double duty, but we're doing it safely from from home in order to do our part in making sure that everyone stays safe during this pandemic. And I'm thrilled to be here with you, Dante, for this really exciting announcement about the Can Health Network. This past year, as I said, has shown that few things are more important than the strength of our healthcare system and ensuring that Canadians have quality care. And our government is committed to finishing this fight against COVID-19 and supporting businesses and Canadians through this pandemic and certainly into recovery. And while we invest in health services, we are also working to support entrepreneurs and businesses in this health space so that they can bring their innovations and solutions to Canadians. And that is what the Can Health Network and the integrated market is supporting. High potential companies to access billions of dollars of procurement spending and to bring those innovations, those technologies, those solutions into our healthcare system. And not only is this helping businesses in the health sector to scale here at home, the Can Health Network anchors the experience and the talent of these businesses that are growing here, that are scaling here, and they're anchoring it here in Canada so that they're set up to succeed. Because when they grow here in Canada, I'm the small business minister, but I'm also the international trade minister. So getting businesses growing here, anchored in Canada, and helping them grow into the international market is what this integrated market is really helping our businesses to do. So in Ontario, Can Health has already connected 12 healthcare organizations to launch 10 projects with 15 businesses aimed at providing solutions for healthcare challenges. A great example, who you're going to hear from very shortly, is CANImmunize. It's an Ontario-based company, and they're with us here today. CANImmunize developed a digital tracking system for mass COVID-19 vaccine rollout, which is now successfully being used to schedule appointments for vaccinations across Nova Scotia. And then there is Precision ADM, a Manitoba-based company that is currently manufacturing N95 masks here in Canada, made with materials from Alberta, and the Can Health Network is helping them to sell across the country. These projects are terrific examples of Can Health's integrated market, helping our small health solutions businesses sell and to scale their made in Canada solutions across the country. And in doing that, also getting them ready to export into the international marketplace, which really brings me to today. To continue to build on the success of the integrated market, I'm very thrilled to announce an additional investment of $3.25 million to Can Health's network here in Ontario. I'm also very excited to announce an additional investment of over $2.2 million for the Can Health network to expand into Atlantic Canada. In Ontario, this top-up funding will allow Can Health to support an additional 10 innovative technology firms as they work together to bring their solutions to market. This expansion means working with the healthcare providers in New Brunswick, Newfoundland, Labrador, Nova Scotia, Prince Edward Island to support Atlantic health technology businesses so that they can bring their innovative solutions to the Canadian market. So over the next 2 years, this integrated market will connect healthcare organizations with promising Atlantic businesses to bring new cutting-edge solutions to the Atlantic health system while unlocking the potential of these incredible innovative businesses to sell their solutions not only in Canada, but indeed abroad. So simply put, the Can Health Network supports the Canadian healthcare system while ensuring that Canadians are the first to benefit from the incredible made in Canada health innovations, the technologies, and the solutions. So today's announcement just really increases this progress, and our government will continue to put the health and safety of Canadians first as we finish the fight against COVID-19, and we will continue to support our businesses throughout this economic recovery. I'm really looking forward to seeing new health innovations that are getting developed, that are going to be adopted and nurtured through the Can Health Network. And through the work of the Can Health Network, you're going to scale them in Canada. And when you do that, you're going to help those Canadian companies scale in Canada, and we're going to work together so that we can bring them into the international market. So I'm going to give the floor back to Dr. Mara, who will introduce who will, I think, introduce the panel because I think Minister O'Regan is still in the Parliament. And while he does that, I'm actually going to vote. So you'll actually see what I do in voting, which really is putting up my phone to me so they can recognize and register my vote. But to that, merci beaucoup. And I'm going to throw this back to you, Dante, while I pause very, very quickly for a vote, but please continue.
Okay, awesome. Thanks so much, Minister Eng, and thank you. I can feel and sense your passion for Canada, for scaling our small businesses, and for creating trade and the many things that you do. And that's what this is all about, an integrated market that brings over $30 billion of purchasing power to a marketplace to scale our great Canadian companies across the country and get them ready for international scale as well, while solving problems. So I'm going to pivot a little bit. That's been COVID and in the agenda. And I'm really excited actually to introduce the lead edge of the Atlantic. And so one of my favorite parts of being a part of this is you actually meet all these special people across the country that you normally wouldn't get a chance to meet. And Jennifer Shields is one of those critical people. This is someone who's a passionate Canadian, a leader in her work. She's a chief information officer at Horizon Health, but just a spectacular leader, and is our lead. Horizon Health has taken a great leadership role in the Atlantic region. We're so excited, the energy coming and on the opportunity in this area. And Jennifer's already in Horizon Health, has already actually led our national RFP with multiple different provinces. So Horizon has already done some great work and some amazing work happening out east. So Jennifer, I'm going to pass it over to you. We're so excited about the launch of the Eastern segment of the network. And over to you, Jennifer.
Well, thank you. And hello, bonjour. Thank you, Dante. Thank you, Minister Ing, for those remarks. And thank you to everyone for being here today. We are so very proud to be serving as the lead edge for the expansion of the CanHealth network here in Atlantic Canada. This is a really big day for healthcare innovation in the Atlantic region. And speaking on behalf of our member edges, I know we're absolutely thrilled to be a part of this and can't wait to get started. We are a small but mighty community in the Atlantic, and each of our edge members bring an immense amount of knowledge and passion and experience to the table. We also bring some very unique expertise to the CanHealth network. We represent a diverse spectrum of healthcare specializations across a few provinces. So looking at our partner edge organizations here in Atlantic, we incorporate acute care and primary care with the various regional health authorities. So including Horizon, we have Vitalité Health Network, we have Eastern Health in Newfoundland and Labrador, we have Health PEI and the Nova Scotia Health Authority. We incorporate specialized tertiary care services with partners such as the IWK Health Centre in Nova Scotia. We incorporate long-term care with partners like Shanex, and we incorporate home care, paramedicine, and emergency medical services with partners like Medavie. We're also really proud to include our first French language edge partner to the national network. So bienvenue à la Réseau Santé de Vitalité. We are already a very tight-knit group of healthcare providers, and we share common challenges and objectives. So our inclusion in the CanHealth network will only strengthen these bonds. And I must say that the expansion into the CanHealth network would not be possible without the support of our funding partners. So I'd be remiss if I didn't offer sincere thanks to the Government of Canada, including FedDev and ACOA, for recognizing the value of this outstanding initiative. And of course, I'd like to recognize Minister Ing, and I know Minister O'Regan will join us, but their continued support of this partnership for being here with us today is really much appreciated. Together, we look forward to rolling up our sleeves and forging new connections with innovators in our region and beyond to bring leading edge solutions to the marketplace. There is already a really robust ecosystem of innovation that exists here in Atlantic Canada, and I know we're ready to hit the ground running and drive this process forward. Today is certainly a cause for celebration. And again, speaking on behalf of our Atlantic team, I'd like to thank CanHealth for formally welcoming us into their network. Thank you to Dante and your team for working with us so collaboratively over the last year, bringing us to today's announcement, and for everyone who's had a role in making this possible. We can't wait to share some of our Atlantic success stories in the months and years ahead. So thank you all again, and merci.
Thank you so much, Jennifer. And we're really excited for the success that will come out of the East. And today we're highlighting projects from Manitoba that have gone to Ottawa and projects from Ottawa that have gone to Nova Scotia. And we're super excited to highlight the work that you've done in the national RFP crossing the entire country, and really excited for the next steps and the work that you're doing. There's 8 new edges coming, and I think Jennifer described them across all the different provinces, but they actually add to the network. We don't have a transport partner right now in EMS, and that actually increases our exposure, and also with Shanix. So lots of new opportunities for integration and to power the integrated market, and we're super excited to work with you. So welcome, and I'm really excited for the results that will come. I'm going to pivot a little bit, and we're gonna start moving into the panel. But there's a couple just things I just wanted to comment on. So, what is most inspiring as we do this? It's the results, right? So we have AI companies and natural language processing companies like Semantic Health working with groups like Sick Kids and on coding, and we're going to be really excited to tell that story. We have edges like Briere in Ottawa that have been truly leading multiple different projects, and you're going to hear about the CANImmunize work. We have Saskatchewan Health Authority that's been doing great work leading in the West, and some great projects there. And it's what's been so neat is to watch their response right through COVID operationally and leading the country in many different ways, and their leadership in the network. And we have many partners who have been with us from the beginning. So I have to just take a moment to thank our public officials at FedDev, WD, and ACOA. This has been a creation of many people. It's been with companies, it's been with edge partners, it's been with regions, but it's also been with our regional development agencies. And they have co-created this with us. And this is really the first project that you've seen the regional development agencies working across the country. And I believe the first project that WD funded 4 different provinces simultaneously. It's showing the willingness to try new things and to create this integrated market. So we've had lots of time with our officials in many different areas. And thank you to ACOA, WD, and FedDev for just the tremendous work that you've done. Another partner who's been with us from the very beginning is Deloitte. So Deloitte has been an amazing partner and sponsor. They're obviously an amazing consulting company that works across the country, and with many of you as operators and everything from strategy to operations. And they're really been focused on the Future of Canada project, which they have a great report. And I just want to take a moment to thank Deloitte. They powered our AGM, which was a great event bringing Canada together, but they're also powering us in many different ways. So huge hats off to our partners at Deloitte. So we're going to, Minister O'Regan isn't here yet. So Minister Ng, I think what we'll do is we'll move into the panel, and then I will give Minister O'Regan a chance to comment at the right time. He's been a huge, passionate Canadian. I loved getting introduced to him through Sheldon Levy, who's been a bit of an architect of the integrated market, and his passion as our Minister of Natural Resources, a champion of Atlantic Canada, but also just a Canadian champion of business and integration across the country. So we'll give him a chance as we move into the panel. And I'll now introduce our panel participants and move into this stage. So the first person I'd like to introduce, we heard about CANImmunize, is Dr. Kumanan Wilson. Kumanan was someone who was actually very early on in the Can Health Network's conception and early thinking. He's an internal medicine specialist at the Ottawa Hospital. He's a CEO of CANImmunize, an amazing Canadian company that we talked about that created Canada's first digital vaccine record. And CANImmunize partnered with Briere, one of our edges in Ottawa, and has recently started scaling and helping on COVID vaccination in Nova Scotia and I believe the Yukon. Cool moment. So Trillium has done about 200,000 vaccines as a vaccination center. And there was a moment where I saw a nice tweet from an Ontarian saying, I booked in Ontario and I booked in Nova Scotia. Nova Scotia is way better. And the experience has been way better. Why can't Ontario do it like Nova Scotia? Well, that's because they have CANImmunize. So not to take anything away from the COVAX system and our partners, but Canada technology can compete with Salesforce. Our next panelist is Jay Singh. So Jay, great story, has spent a lot of his career in health innovation on the procurement and supply chain management. And he's been critical during the pandemic, and he's joining us as the Chief Commercial Officer for Precision ADM. Another story of a scaling Canadian company right in the effect of helping with COVID. Jay will tell you the story of Precision ADM, but coming from Shared Health Manitoba. So our Manitoba edge, super excited about this scaling out to the Briere area. And I'm super excited. Welcome, Jay, to the panel. And finally, we had a chance to hear from Jennifer, who you've met, but just an amazing executive with over 20 years of experience in leadership and information technology and communications. So with that, I'll pass the panel over to you, Minister Ng, and when Minister O'Regan comes, we'll introduce him. Over to you, Minister Ng.
Well, thank you so much, Dante. And I can tell you, he will join us. I think he'll join us. I think there's one more vote left. I just, when you see me do this kind of thing and move it around, it's because I was voting. So I managed to get that one in before we started the panel. So let me get into it. This is absolutely fantastic. I love the opportunity to have Dr. Wilson with us, to have Jay with us, to have Jennifer, and you, of course, Dr. Mara, and I think everyone will learn a whole lot from this wonderful conversation. I always do. But, Dante, you and I had this conversation some while ago about the CanHealth Network. You, of course, you're the chief of medical for Trillium Health Partners, and that is it's a big institution. It's a big organization. It's one of the largest community-based hospital systems in Canada. You're also a specialist in internal medicine. You're also an assistant professor at the School of Medicine at U of T. So I would dare to say that you are a busy person, being a doctor and being the chief of medicine. But yet, when we actually had the first conversation, you had actually said to me how important it is and what the opportunity is, because you do actually see made in Canada. You do see the innovations and projects. And I don't even want to call them projects because they really are businesses. They're businesses and they're innovations that come to your door. But what could you actually really do with them as the chief of medical, even at a very large community-based hospital? So last year, the CanHealth Network ran 18 commercialization businesses, like business projects during this global pandemic. What has been the most significant part of this journey for you?
Yeah, so thank you, Minister. And I think there's probably a couple of things that I'll highlight. So the first is that this is about results. This is about creating an integrated demand marketplace that's bringing purchasing power and is scaling companies. It isn't about creating a video. It's not about creating a research paper. It's about scaling Canadian companies. And we've completed 10 projects of the 18. We now have 22 edges. And 80% of them have been successful. So that's scaling internationally, scaling across the country. So it works. So we can take an edge in an environment, identify a problem, attach a company, show that it works, and scale it across the country. That's what matters. It's about prosperity. It's about jobs. It's about actually using the demand marketplace. That's really, really important. The second part is uniting the country. So this is rare. It's rare to have healthcare operators from all across the country working together to create jobs that start in Newfoundland with a company that gets access to the Ontario and Alberta and BC and Manitoba marketplace. So the jobs stay there and then they grow. And that's what's been really amazing about this. As we've met different people, every month the edges all come together to talk about their projects. And that's helped in everything from COVID response and us sharing knowledge, but bringing the country together to create a marketplace that has the buying power of California. That's what you need to create global Canadian companies. And it can be done. We've done national procurements. The edges are procuring and moving forward. And then the third piece is, fundamentally, this is about prosperity. If Canada doesn't lead and create a prosperous country and lead new economies like healthcare, space, agriculture, manufacturing. There is no prosperity for the social values that we care so much about. It is necessary. This is absolutely essential that we don't become the blockbuster that gets disrupted by other groups. We have to lead that. And I think what we've seen is not only can we create scaling companies, that we can bring this marketplace, that we can bring the country together, that there's shared learning and teaching, but actually it works in health outcomes. So whether it's Maple with virtual care and long-term care, I know 50 people that would have had bad outcomes or died had they not had that technology. It's amazing that Maple is creating prosperity. That's the goal. Saving lives is the outcome that comes from that. CANImmunize, we talked about that as part of the response to COVID. We have Precision ADM who will talk about COVID. Verdo, which is powering many of the vaccination centers here in Ontario. These are not just technologies creating jobs. This is actually life-saving medicine in a different way. So it's those four things. Results, it can be done, bringing the country together, creating prosperity in the future of the country, but fundamentally, we can positively disrupt healthcare, and it can be better for all. And it's been a collaborative effort. We have learned from every edge. Every group has had their DNA in this. And it's a made in Canada solution and regionally led. So I'll pass it back to you, Minister.
Well, Dante, thank you so very, very much for that. And I couldn't agree with you more. The approach that our government has taken throughout, and certainly during this pandemic, has absolutely been a Team Canada one. And when I describe my job, I'm like, okay, I'm the Minister of Small Business and International Trade, but you know what the job really is? It's the Minister of Startup, Scale Up, and Access New Markets. Far too often, I was seeing companies who were finding it difficult to really scale here in Canada, and certainly in a sector like the one that you are all a part of, which is the healthcare sector. There's such incredible innovators and solutions and technology and processes, and we are going to hear from a couple of them very shortly. And that's essentially, as I said earlier, how do you help these companies actually get into what is the Canadian market and the Canadian innovation? And this question is to Jennifer. You have been, you've spent your career in the IT sector, in both private and in the public sector, and you're at Horizon Health Network. And here on the one hand, we've got, we saw a bunch of Canadian companies looking to scale and essentially get that big customer, work with using their Canadian innovations in a Canadian setting so that their solutions are benefiting Canadians first, and in the course of that, growing. So my question to you is exactly on the side from an edge or edges from the healthcare organizations. What advice would you give to the health organizations who you now are essentially sort of working, sort of bringing into this CanHealth network, as they need to consider adopting these very technologies, these very innovations, so that, as Dante said, it is disrupting healthcare positively, but doing so in a way that also will yield the best benefit to our Canadian innovators and businesses?
Well, I like the word disruptive in that it's positive disruption. So in my experience, I guess I'd have to say that a key success criteria is, as a healthcare organization, we need to embrace a culture of innovation and change. Typically, we tend to be quite risk adverse, and rightfully so. We always focus on patient safety, quality care, good patient outcomes. A lot of what Dante had articulated in his key message, that is some of the outcomes that we're realizing through this network. I know that in traditional healthcare organizations, when you consider embracing innovation, sometimes it is perceived as a negative disruption. We need to change the narrative on that. My advice would be to ensure in the organization strong guiding principles are in place, remind stakeholders that the clinical needs drive the technology and not the other way around. Digital transformation and technology adoption always needs a champion, someone who's clinically active, who's influential, and can help ease concerns or fears about change. I would also say that as an organization, we need to also consider that a reasonable level of risk might just be okay. I think our response to COVID-19 is a really good example of this. When we're faced with new challenges and time constraints, your decision-making criteria adjusts accordingly. And I think that's where the concept of positive disruption comes into play.
Well, thank you so very much. Just connecting sort of that dot back on the point that you made, which is, which I love about this. Dr. Mara, as I said, you're chief of medical for one of the largest community-based hospital systems in the country. And so you're a medical professional. And my next question is to Dr. Wilson, who also is a medical professional. But having the Can Health Network essentially, be co-led with the healthcare providers on the one hand, but taking on an active responsibility with those who will play a part in that positive disruption to get to those outcomes that you all care about and that communities care about is really what this network is. And Dr. Wilson, I had read that the catalyst for CANImmunize came from a conversation with a mom that you had in Ottawa Park. And it was over the frustration of the yellow immunization card, which sparked this idea for you. And maybe now is a really great time for you to share with everyone, what is CANImmunize? And what were some of the biggest barriers or challenges that you have faced getting it into the market? And how did you overcome it? Because I think your story, this experience, is the practical reality of a solution, but a solution to get into something that really becomes a solution, and then one that is a solution that can actually have broad application.
Thanks, Minister Ing, and thanks to you and Dante for your leadership and vision on this amazing project. So this has been quite a journey for us, and we appreciate all the support along the way. So also congratulations to the Atlantic. I'm from Fredericton, New Brunswick, so I'm a proud Maritimer. And actually, ties back to the origin story of CANImmunize. It actually happened after the last pandemic, after H1N1, when I did have a conversation park with another New Brunswicker in Ottawa from the Miramichi. So New Brunswick is a really important part of this. And she did say, this is ridiculous. I can do a lot of things on my phone, but I have my paper records. And then that prompted us to develop what would be a first of in its kind solution, Immunize On. And we kind of knew it was a first of its kind solution because Apple contacted us and said, we've been waiting for someone to develop one of these. It seems like a logical application to build. And then from that moment, it started to get traction, and the federal government saw the value of this to help Canadians connect with their immunization records and take control of their own health information. And we've been generously supported by the federal government over this time period. So this is an example of how a federal investment way ahead of the rest of the world. The federal government invested in digital immunization records, over the last 10 years, and it puts us in a good position coming into this pandemic. And it allowed us to develop this application and make it Canada-wide in both official languages across all platforms. And over the last 10 years, we've had the great opportunity to work with our public health officials across the country, and our local public health officials, like Ottawa Public Health, has been amazing in allowing us to pilot solutions. So I think that's an important lesson we've learned, working with people on the ground and recognizing the value they bring and understanding what the actual problems are. But about the beginning of last year, we realized that this isn't really a research project anymore, as Dante would say. This is more than research right now. And maybe the home for it wasn't the hospital. So we spun out and we took control of the product for probably the beginning of last year. And then 2 months later, the pandemic hits. And suddenly we're in this situation of where we have a solution that we realize is going to be needed, but we were a 5-person team, a brand new startup. And how were we going to get ready for what was to come? But one of the advantages of doing this for the last 10 years is we knew what problems were going to be coming. We knew what type of solutions needed to be built based on our experience. So we started to build a solution for influenza vaccine campaigns. But we needed a partner. And it's hard for a hospital to take a chance on a small company. If something goes wrong, they're going to get blamed for it. And we needed a partner who had a forward-looking vision, recognizing the role of innovation and digital technologies, and Briere was that partner. And they deserve a lot of credit for what has ensued. But they also needed support as well, and that's where CanHealth comes in. Through the support from CanHealth, you de-risk the project and you support them. Hospitals have a lot of competing priorities, and they do need this type of support so that they can take a chance on a smaller Canadian company. And it's a combination of a hospital willing to take this risk and the support from CanHealth that allowed us to co-design this with Briere. And the co-design was important because we didn't realize booking was so important. It was Briere that said, oh, we need a booking part of this. And that turns out to be one of the key elements of the solution we built. So it's a problem one. Anywhere, but we didn't have a ton of expertise in the business side of things, and CanHealth has been very supportive of that. They provided the mentorship and helped us learn how to develop and build a company. So I think those were the three of the major challenges we faced, and we had the support because of this program, and it allowed us to develop a solution we're very proud of, and a solution that's helping Canadians through a very difficult time. And I know for my team that's really important. So thanks to everyone here.
Well, thank you so very much for that. I wish that I wish these sessions were a lot longer because there's a lot to sort of to drill in there. But if I would say one thing, the experience that you have just charted and shared, I could say that it is replicated in many folds, because I've certainly heard that along the way, and very, very thrilled about the work that we are doing really as a whole of Canada approach here. Maybe what I'll do now is I will go to Jay, to you, and your company, of course, is Precision ADM, and you are I'm not going to pretend to try to describe the company. So I'm going to actually just say here, maybe I'll have you do that. But the question really here is there anything particular that you had or you didn't have in this past year that would have helped your company succeed?
Well, thank you, Minister Ing and Dante, for your leadership, and CanHealth to provide us this opportunity to really a little bit tell about our company. So for context, Precision ADM is an advanced digital manufacturing company. So we are the people who make metal 3D printed parts for implants. We are in people's knees and ankles and hips. And then we are on International Space Station. So everything in between we play in. So from bodies to all the way aerospace, turbines, and everything else. And we worked in this niche sector from last 5 years. We come from Orthopedic Innovation Center. This was where Precision ADM was created out of a nonprofit organization, very small SME based in Manitoba, and very, very innovative technology we were able to bring to the market. We were probably we were able to connect with the federal government and provincial government to provide them the solution. But then CanHealth opportunity came along where Shared Health Manitoba, CanHealth, as well as Government of Manitoba, challenged us into a solving Canada's N95 mask problem. So our challenge was to build a reusable N95 mask, which we can use again and again. It has to be environmental friendly. It has to be super comfortable, and it's need to protect our frontline healthcare providers in a much more stronger way than any disposable or those paper masks were doing. So we got challenged by this group, and our innovative engineering group went to really to the beats to really redesign a healthcare grade N95 respirator. And I'm proud to say that we were the first one in North America to build a healthcare grade reusable N95 half mask respirator. And since we were part of the CanHealth supported us as a small company to really take us to the next level as an edge partner with the Shared Health, and supported us with the fit testing, deploying, and commercializing the product first to the initial to Manitoban market. And when we were highlighted on CanHealth's different webinars and seminars, and other edge members jumped in. From Ontario, Briar Kingston is another one, and few hospital in Trillium there. So SNV found ourselves becoming this Canadian company, which was booming in a very, very fast situation. And now we have a solution, a Canadian solution, which is, I think we have solved the Canada's problem for N95 forever. And it's have done a tremendous job for us. We became a very strong company financially, as well as employment. We went from 30 employees. Right now, we are at 170 employees. Probably by end of the month, we're going to be 200. We have jumped into multiple PPE sector business because we've seen other opportunities along the way, which got exposed to us. We are now in Quebec. We are manufacturing in Ontario. We are headquartered in Manitoba. Now we're looking into Alberta. And with this marketplace opportunity Dante and team have created for us, it's tremendous. There hasn't been this kind of opportunity available for Canadian entrepreneurs prior to CanHealth initiatives, because healthcare, as Minister you mentioned earlier, it is very close knit. It's close knit by GPOs and contracts and so on. Canadian innovators, it's very, very difficult to get into this healthcare stream. But what CanHealth have done for us is really put us on a map. We are now being contacted by US firms to participate into the US opportunities and other. From South Africa, tomorrow I'm having a call with South Africa, and in the UK and others. So it is, I am just so grateful we got this opportunity, and we have changed it into a Canadian innovation highlight for all of us. It's the, I'm a proud team member of this team who have delivered this tremendous innovation. I think overall I think in the upcoming our innovations and other scenarios, we definitely will be engaging with CanHealth and expanding our opportunity and partnerships with CanHealth and Dante's team in much more cohesive ways. And Minister O'Regan have joined us. Dante, over to you first.
That is absolutely wonderful, Jay. I love all of that because remember, I'm the Minister of Startup, Scale Up, Access New Markets. Guess what? Your company has started. Your company has scaled up through CanHealth, and your company now is accessing those new international markets to which Canada has free trade agreements with. So that's absolutely terrific. But with that, I'm going to throw it to Dante because, hi, Seamus. You're on mute.
Unmute me. There we are. How are you?
I'm good. I'm good. I think Dr. Mora is going to introduce you, and well, Dr. Mora is running the program, so I should stop talking.
I was about to say, it's hard to MC this group. So Minister, we've heard some great success stories from some Canadian companies of how they've, scaled from Manitoba with Alberta products to Ontario and elsewhere, and from Ontario to Nova Scotia. Lots of success in changing outcomes, creating jobs, prosperity. And I had the pleasure of meeting you through Sheldon Levy and some of the work that you were doing out in the Atlantic provinces and with Newfoundland. And you're an incredibly proud Canadian, passionate about Atlantic Canada, about Canada. And as our Minister of Natural Resources, it's a pleasure to have you speak to us. And this is the Can Health Network, and to make some comments. So thank you so much for joining us, and I'll pass it over to you to make some comments.
I am speaking to you. Thank you, Dante. I'm speaking to you literally just coming out of the House of Commons, where we had votes, and I was holding down the fort there. So I won't be long, but I will be incredibly candid because I have no notes prepared here. Let me just say, first of all, Dante, you made quite an impression here in St. John's when you spoke at our tech summit. We have a burgeoning tech sector here in St. John's that I have keenly been interested in ever since I went to Ireland almost 30 years ago to study the Celtic tiger back in the day, and to see, how a country very much like my province here in Newfoundland, what were the similarities? What could we be doing? What structures could we put in place to leverage the talent pool that was there? The Irish have figured out a whole bunch of ways to do that. But you and Sheldon and Mary and the rest of the Can Health team, you guys have figured out how to leverage one of Canada's great institutions, which is our public health system. And how do we leverage that to build technology and to build startups? And it is almost deceivingly easy when Sheldon first explains it to you. It is far harder to put it into place. That still requires a lot of hard work and determination. But Dante, I can tell you, for whatever it's worth, having the minister in charge of, you just gave yourself a new title, Mary, which I really quite liked. But having all you do, I don't even do. She doesn't need a title. She doesn't need a title. Minister Mary Ng. That's all you need to know. That's Prime Minister, that's what he knows. And I'm, as the Minister of Natural Resources, we are fans of you guys. We are fans of Can Health Network. We are very keen to see a beachhead here in not only in Newfoundland and Labrador, but also Nova Scotia, New Brunswick, PEI. We're going to go. It's going to be really interesting to see how this country changes over the next few years as we come out of this pandemic. One of the things that's very interesting, I think, and Ireland suffered the same problem, is that we're a nice place to live. But, I lived in Toronto for 15 years. I lived in New York for 3 years, lived in other places. But the quality of life here is really quite good. And if I can do what I want to do and realize my dreams and grow my business in this place without being hindered in any way, you may see more and more people move to smaller jurisdictions like mine. And I can tell you, that's the kind of assistance and help and growth that we want to see in these provinces. Nobody wants to get a check for doing nothing. People want to attract talent. They want to build businesses. They want to grow economies. And it floors me every time, Dante, I listen to you speak, how, as I said, how deceptively simple this is, but how incredibly smart it is. It is so smart. And I'm seeing people who are moving back here to this province who are my age or a little younger and want to raise their families here and know now that they can do business here. And as long as we can provide them with the access to capital and the access to market, let them do what they do. Let them grow. Let them help grow our great country. So that's it for me. Thank you very much for your patience. And again, I'm very sorry I'm late. I was looking forward to this all day, but democracy keeps getting in the way with its voting and stuff. Anyway, Mary, back to you.
Well, I was voting here because I had the benefit of another screen, which, by the way, also sort of took up how to, how to do that piece of it. It was incredible, but it all worked.
I don't have the
all
nerves
working.
of steel that you do to conduct a meeting and vote at the same time. I swear, like I don't know what happened. I'm not capable.
Well, I was
As usual,
telling
I
the whole,
admire you.
I was telling the audience, I said, excuse me if I lift up my phone. It's not because I'm not paying attention, but I actually am voting in the House of Commons. So, doing that too. So anyhow, I'm just taking a look at time here, and I've got one final question to all of the panelists, we're on that road to recovery. The government of Canada released a budget, a very ambitious budget, a couple of weeks ago. This is about finishing the fight against COVID-19, getting Canadians back to work, getting on that road to recovery, helping our businesses, helping women return to the workforce with a $30 billion investment in affordable early learning and childcare. So a range of investments. So of course, a lot of our work is very, very much focused on finishing this fight and also on that road to recovery from COVID-19. So here, it's a pretty broad-based question. I mean, it'd be wonderful to have your perspective. But what do you see? What role do you see CanHealth being able to play supporting Canadian businesses in this economic, in this road to recovery, and what benefits do you see for businesses, but also for the healthcare institutions who I know through the CanHealth network are really, really excited to be a part of this journey as well. So maybe I'll start in Atlantic Canada with you, Jennifer, and then I'll move along.
Sure. Well, I appreciate that. Thank you. I think the reality is that COVID has taken us off a course we were on. The problems we were experiencing, the challenges we had haven't gone away. In fact, they've probably grown exponentially as a result of all the new challenges that COVID has brought forward. But here's the opportunity, and here's what's very exciting for me, and I believe for my partner organizations. Now we don't have to solve these problems alone. Our challenges are very common from one healthcare organization to another. Now we can collaborate to understand who has the ability, the capacity, or the partners. Maybe you have a local incubator or an accelerator that you can leverage, like Minister O'Regan had mentioned in Newfoundland. Exceptional relationships already exist in these ecosystems that we can actually partner and launch these projects to say, can we address this? Can we find a solution that's Canadian grown, demonstrate that they prove to meet our needs, and help to partner so that they can actually grow across Canada? These problems aren't going away. So I'm really excited that we don't have to face these challenges alone. And for me, I think that's the exciting part of all of this, that we're going to be able to table our collective priorities, understand who's ready and rolling up their sleeves to lead these projects and getting them underway. And it's a very exciting time for us.
Yeah, I think, Minister, and I've been asked to close, but couple comments. You have the solutions right here. When Canada unites to create integrated demand marketplaces that can scale Canadian companies, and they can go to the rest of the world. Jay's talked about how he's solving a real problem in Manitoba with Alberta products, hundreds of jobs being created in Manitoba. And Mr. O'Regan, the talent of Atlantic Canada, the talent is there, and it gets access to a $30 billion marketplace, 30 million lives, size of California, and scales. And our country gets small and focused, not just on recovery, but in reinventing itself. Because it's not about looking back, and we can be better. We can come through this stronger. The government is investing, and we have to be forward looking in how we do that. We've highlighted CANImmunize. There's companies just like Virto. Virto is a great Canadian company that is helping us on our immunization in Ontario and elsewhere, on the St. Joe's Edge in Hamilton, working across Ontario. The solutions are here. The talent is here. And so We're going to make you really proud through CanHealth and show how it can be done in health. And Mr. O'Regan, we're going to do it in sustainability. We're going to create an integrated market in sustainability and in agriculture. There's a future space industry that Canada should lead. The bottom line is we need an environment that uses the purchasing power of this country to unlock the potential of this country. And that's simply what the integrated market is. And that's what you started. And your challenge, and this is the country coming together, launched in Vancouver, Saskatchewan Health, Manitoba, BC, Alberta, right across this country. And we're so proud to announce the Atlantic component of it. And we're so thankful for your support and the support of everyone who's been a part of this. So this is the beginning of a railway that will extend elsewhere, which will make this country small, prosperous, bring new ideas, and create many, many companies. And Precision ADM will be buying up companies in the US, just the way that Point Click Care did in Mississauga. They bought up the American competitors. They're the global leader, $4 billion in purchasing power. That's what this is all about, to solve real problems. And we can make this country small, and the jobs stay where they start. They stay in St. John's because they get access to the global markets. And that's what it's all about. So thank you for your support, all of you. And thank you to everybody who joined us, because this is the beginning of where we're moving towards leading a new healthcare economy, but really about reinventing how the prosperity can power the rest of the country. So I know I'm supposed to pivot a little bit here, and I know there's some media that may be wanting to ask some questions, and I'm to pass it over to Yomi Han, who's going to help us do this next segment. Thank you to everybody who joined us. Thank you for your participation, and thank you to all of our edges who are powering the network as we move forward. So with that, I'll end the formal event and move us into the next segment. Have a great rest of your day.
Thank you so much,
everybody.
Dante. Thank you so much. Thanks everyone for taking the time to join us today. I know we are running a little bit late, but we will take 5 minutes to, we'll open up the floor for 5 minutes to take any questions. One question, one follow-up. So please use the raise hand function if you have a question, and identify yourself and your outlet for reporters. Thank you. All right, we have Alan Cochran from the floor. Please go ahead with your question, Alan. Never mind. Sorry about that. All right.
Can you hear? There we go. Hopefully. Thank you so much. Just two quick questions. Can someone explain briefly the term edges? And also, here we are in Atlantic Canada. I'm really would like to just kind of ask, what are some examples of businesses in Atlantic Canada that could benefit from this program?
Maybe I'll explain the edges, and I'll pass it over to Jennifer on some of the great companies out in Atlantic Canada. So the edge is one of the ways the network works. So everyone who's an edge is an operator. So you can be a surgical center, private surgical center, or you can be a healthcare region, you can be a hospital, you can be a home care. You have to operate, you have to buy stuff, and you have to have patience. It's really important. An edge does 4 things. The first is it tells the marketplace what it wants to buy right now. It says, we have a problem right now. We want to buy this. That's very valuable to the marketplace because the Canadian company then knows what to actually attack. It then takes a Canadian company, the edge, and attaches only a Canadian company, not a professor with an idea, a Canadian company, to that market-ready problem. That Canadian company is on the edge of an organization. It's a warm, helpful place. And the company then attacks that problem. Third thing, the edge is connected to all the other edges across the country. It tells people about the great project that it's doing. And every month our edges meet, and they're sharing what those companies are doing across the country. And all the other edges across the country are getting interested because you know what? If Sunnybrook is working on a problem that Saskatchewan cares about and Sunnybrook's solving it, Saskatchewan cares about that because they want to buy it. The fourth thing is when the edge procures, we name all the other edges across the country so that company can then scale across the country. So an edge, a warm part of an operating environment, shows a problem, helps the company attack the problem, tells everybody about how great it is, priming the marketplace, procures and scales.
In terms of some of the opportunities, we're really excited to leverage the network of the marketplace that ACOA will bring to the table, business development partners in each of our own jurisdictions that we will be able to partner with to help, I guess, promote and bring these innovations to the table. What we'll do as healthcare organizations is we're going to collaborate to find the opportunities, the challenges that we were trying to solve. And we will be bringing these in a very transparent way to the local marketplace to come and make themselves known, identify themselves so that we can choose the best fit for the partner organizations to work with and get a project rolling. So we're going to leverage a framework. We don't have to figure this out for ourselves. Luckily for us, Dante's team in Ontario on the western edge as well, they've already worked out some of this groundwork that we get to reap the benefit of. So I'm even happier about that. But we're really excited to do that. So any of those innovation companies that are trying to get through the doors that tend to be really hard to get through from a procurement point of view to our hospitals, this is going to change the landscape quite fundamentally.
Thank you. Thank you so much for that. Minister Ng, would you like to add something?
Yeah, thank you, Alan. I'm really pleased with today's announcement. I mean, today's announcement is the federal government making additional investments in the CanHealth network. It is providing that opportunity for us to grow and scale Canadian companies. And now we're adding Atlantic Canada through the $2.2 million of investment. And this really just enables the organizations, the healthcare organizations in Atlantic Canada to be adopters. And it also allows terrific companies, those made in Canada healthcare solutions or technology, those wonderful entrepreneurs based out of Atlantic Canada to scale not only in Atlantic Canada, but indeed throughout the CanHealth network. So they are accessing a market here all across Canada. And as you heard from one of the companies that's here, when we're able to scale and grow those Canadian companies in a real world setting, which are these healthcare organizations, that scaling anchored in Canada means that they will grow because Canadian innovation and Canadian solutions are really in demand elsewhere. So when they grow here in Canada, they will also grow into the international market. And this is really about creating jobs, but it is also about leading and innovating through the CanHealth network.
Thank you very much, Minister. We have time for one more question from the floor. If you have a question, please use the raise hand function. I will give folks a few seconds to do so. All right, we have Martin. Martin, please identify your outlet.
Yes, hi. My question is, I'm hearing about the expansion of the CanHealth network and the new funding for Ontario and in the Atlantic, and I was wondering if there was funding that would be approved to allow CanHealth network to also expand into Quebec.
That is a really, really terrific question. And right now, CanHealth, of course, is in Western Canada and Central Canada and has moved into the Atlantic. And we absolutely are looking at continuous expansion. We remain committed to growing out this network. And this work will absolutely continue. So I guess the answer is please continue to stay tuned. What has been terrific about this network is that it has grown through the collaboration and the partnering between many, many healthcare organizations, of course, led through the CanHealth team, but absolutely our intention is to make sure that this is available throughout, including in Quebec and in the North. So stay tuned.
Thank you very much, Minister. That is all the time we have for today, unfortunately, but if you have follow-up questions, please feel free to get in touch with our office. And at this point, I just want to wish everybody a good day, and thanks again for your time for joining us.
Thank you, everybody. Have a good day.
Thank you.